Bacterial infection in newborns. Neonatal infections are primarily bacterial in origin and include pneumonia, sepsis, and meningitis. Neonatal infection result in over 1,500 neonatal deaths every year. Most of these deaths can be averted by preventive measures, early diagnosis, timely care seeking, treatment with appropriate antibiotics, and follow-up. Early diagnosis requires early recognition of clinical signs, symptoms, and syndromes. Possible serious bacterial infection is the most important clinical syndrome in low and middle-income countries. An estimated 6.9 million episodes of possible serious bacterial infection occur in young infants aged 0 to 59 days in low and middle income countries every year. Symptoms. Newborns with sepsis appear generally ill. They are listless, do not feed well, often have a gray color, and may have a fever or a low body temperature. Sepsis is more likely to occur in infants who have a low birth weight, infants who have a low Apgar score, infants whose mother has certain risk factors such as a low socioeconomic status or pre-labor rupture of the membranes, and of course in males. Sepsis categorized as early onset sepsis, before 3 days of life, late onset sepsis, after 3 days or more of life. Early onset sepsis. Newborns can develop early onset sepsis if they are exposed to certain kinds of bacteria during birth. Risk factors for early onset sepsis include the following: pre-labor prolonged rupture of the fluid-filled membranes that surround the fetus, infection in the mother such as chorioamnionitis, presence of group B Streptococcus GBS in the mother, preterm birth of the fetus. Late onset sepsis. Newborns can develop late onset sepsis if they are exposed to certain kinds of bacteria in the hospital. Important risk factors for late onset sepsis include the following: preterm birth, prolonged use of catheters in arterial veins and or bladder, antibiotic use in the newborn, use of breathing tube inserted through the newborn's nose or mouth and the tracheal tube and attached to a machine that helps air get in and out of the lungs, ventilation, to help support breathing. Prolonged hospitalization newborn in the clinic. Symptoms of sepsis in newborns. Newborns with sepsis are usually listless, do not feed well, and often have an unstable body temperature. Fever that lasts for more than an hour is uncommon, but when present, typically indicates that the newborn has an infection. Diagnosis of sepsis in newborns. Cultures of blood and sometimes urine, spinal tap with culture of the spinal fluid. Laboratory test, we use bacteria culture test. Prognosis for sepsis in newborns. Sepsis is a major cause of the death in preterm newborns after the first week. Low birth weight infants have an increased risk of death. Extremely low birth weight infants who have sepsis caused by the fungus, candida, or bacteria are at much greater risk of death. Treatment of sepsis in newborns. Antibiotics by vein intravenously, sometimes a ventilation or other treatments. Thank you for attention.